Good afternoon. So I'll be presenting on the behalf of Dr. Maitri Kalra, who had a baby just a few days ago. I am co-founder of the MedNet and a radiation oncologist at Yale. Tumor boards at NCI-Cancer Centers serve as excellent opportunities for experts to share their knowledge with colleagues and discuss how new research should impact patient care. But the problem is these conversations don't benefit anyone who's not physically present in the tumor board. And so a few years ago, we started to think, can we share these conversations outside the four walls of an academic cancer center and benefit community oncologists? Our idea was to distill discussions from NCI Cancer Center tumor boards into searchable Q&A on the MedNet, an online oncologist question and answer platform. This is what we envisioned. A faculty member would be selected as a site leader, and the site leader would distill a discussion at tumor board about patient management into a concise clinical question. Faculty at the participating NCI cancer centers would be asked to answer questions on the MedNet, and then answers would be peer-reviewed, indexed and stored, and then disseminated via email newsletters to registered oncologists. The idea is that this discussion that started among 10 or 15 physicians in a single time and place would become part of a searchable repository of knowledge, providing long-lasting value to 100 times or more physicians. We piloted this program initially with the breast cancer group at MD Anderson Cancer Center, and this was the first Q&A that was posted by faculty at MD Anderson, and then peer-reviewed by Dr. Henry at Michigan, who had specific expertise in this area. We subsequently expanded to 15 programs at 11 NCI-designated cancer centers, and these are our site leaders at Ohio State, Yale, MD Anderson, Columbia, the University of Wisconsin, UCLA, the University of Utah, Moffitt, Indiana University, University of Michigan, UVA, and Vanderbilt. Additionally, senior faculty at these centers would serve as our tumor board experts. And here is a list of some of our experts. Dr. Maitri Kalra serves as our tumor board manager, and she oversees the program in addition to expansion to additional sites. And Dr. Jean Alvarez at Ohio State helps with moderation of the Q&A. So between December 2016 and August 2019, 15 breast, thoracic, and GI NCI Cancer Center tumor boards were involved. Site leaders posted 184 questions, and faculty answered with 273 answers. These were viewed by over 4,000 oncologists all over the country who viewed the Q&A almost 60,000 times. Answers came from 70 academic physicians and were peer-reviewed by 88 academic physicians. And even though these questions were focused on nuanced and complex clinical situations in the data-free zone, we found that there was a lot of data that was cited, over almost 200 publications that were cited in these answers. Community oncologists participated not just by passively viewing Q&A, but by upvoting Q&A over 700 times and participating in 32 polls related to the questions over 3,000 times. So here's an example of a poll that came out of a discussion at the University of Wisconsin Tumor Board when the Impassion 130 trial was published. We've also found that engagement has been increasing over time. So between 2017 and 2018, which were the full years that we've run this program, viewership of the Q&A increased over 400%. In addition, we've also found that 90% of all the tumor board Q&A are viewed every month, which means individuals are going back and searching and reading these Q&A, and they have this long-lasting value weeks, months, or even years after they're posted. So in conclusion, NCI Cancer Center oncologists effectively made expert knowledge from 15 breast, thoracic, and GI tumor boards easily accessible to over 4,000 oncologists across the U.S. via the online MedNet platform. Community oncologists engaged with tumor board Q&A by upvoting and voting in polls, and engagement increased over time. And future efforts will be focused on increasing exposure to additional disease sites and NCI Cancer Center tumor boards. Thank you.